If you have a child or client with autism or a toddler showing signs of autism or potential signs of autism or delays, you might have heard things, autism screenings and assessments called the MChat, the ADOS, the Vineland, and you may have heard of my digital assessment we call the BECA. Today I am discussing these autism screening tools and assessments and doing a comparison so that you can go in to screening, diagnosis, and intervention with more information. So let's get to it. Hi there, I'm your host, Dr. Mary Barbera, and if you're listening to this podcast, you've probably heard of at least one of these assessments as it pertains to autism, signs of autism, and developmental delays. Autism screening is very important because while we can help kids before a diagnosis, we cannot help them if we are in the dark about what is happening. Today, I'm going into the similarities and the differences between screening tools such as the MChat, the ADOS, the Vineland, and my own digital assessment called the Becca. I've done video blogs on many of these topics in the past, and we will link these in the show notes so you can dive in deeper to any of these topics at a later point. This is podcast 294, so you will be able to find the show notes or anything I talk about in today's show at marybarbera.com/294. Can't believe we're almost to episode 300. Let's start with the MChat, which is a screening tool for autism. It stands for the Modified Checklist for Autism in Toddlers. It's a 20-question screening tool used to assess the risk of autism in children from the ages 16 months of age to 30 months of age, with questions such as, have you ever wondered if your child is deaf? And does your child respond to their name when you call it? These are two critical skills. Another question is, if you point to something across the room, does your child follow your point and look at it? Another really important question that's on the MChat is, does your child point to things? Another area on this 20-question MChat is, does your child copy you, try to imitate you? And imitation is a very important skill. This is the way most typically developing kids learn, and it's often delayed or missing in young children with signs of autism. Parents typically answer these questions, this 20-question checklist, during well visits while they're in the waiting room, waiting for a pediatrician. And it's usually done, it's recommended to be done at the 18-month visit and or the 24-month visit. Some pediatrician offices do it at both times. So the MChat is a screener. It's not used to diagnose, but it can help identify potential warning signs of autism spectrum disorder. And again, it's valid between the ages of 16 months and 30 months. You can also do this MChat on your own outside of your well visits. And it is a screener. So if you do show that your child is at risk, you would want to make an appointment at the pediatrician's office to go over these concerns and take action to get on wait lists, potentially get early intervention in place, and also start intervening with a lot of my techniques, reading my Turn Autism Around book, taking my online course, etc. So some of the problems with the MChat is you do have potential for false positives and negatives since it's a screener. The scoring ranges from low risk to high risk, and you might overscore, underscore. The MChat results could have bias, and there's no direct observation from a third party necessarily. So, and some kids, like I show in my blogs and my courses, you can teach a child to imitate. You can teach a child to point. You can teach a child to respond to their name. So if you teach them all of these things, then they won't have these signs. They could very well still have autism or signs of autism, but you need to dig a little deeper. Okay, so that's the MCHAT. Let's move on to the ADOS. It stands for the Autism Diagnostic Observation Schedule, and professionals need to be trained to complete this. I was actually trained early on. I forget what year it was, but I did go to a 2-day training, I believe, on the ADOS. And there is, certifications and research credentials to do the ADOS at teaching hospitals and for studies. I didn't get that high level of training. I would have been able to administer the ADOS, but one of the problems with the ADOS is it does need to be done in a clinical setting that's sanitized. So you can't do it in a home with, all the toys around and those sorts of things. But it is used for all ages. There is even a part of the ADOS that can be used to diagnose autism in adults. And there are different, I don't know what they call it, maybe stages or phases of the ADOS that if your child's talking, they use a certain part. If they're a teenager, they use a certain part, and an adult. So the young children, I think it says it's for 1 to age 90, but there is also the a mini ADOS, which I'm also trained at, called the STAT, the Screening Tool for Autism in Toddlers, which can be done outside of a clinical setting and usually for very young children, ages 1 and 2. I know that the Children's Hospital of Philadelphia was using the STAT versus the ADOS for a lot of very young children. So the revision of the ADOS is the ADOS 2, and it is used to diagnose and provide severity levels for autism. This ADOS is also a standardized assessment tool, and it is used for ages 18 months and through adulthood with all abilities and language skills, but it's not required to diagnose autism. But especially if the signs are unclear, it is a well-researched tool. The ADOS was created in the 1980s as a tool for autism research and is now considered the gold standard for clinical diagnosis in teaching hospitals. It has more standardization and less bias, and it definitely includes a lot of observation by a highly trained professional, usually a psychologist, psychiatrist, speech pathologist, pediatrician, or BCBA, all with extensive training, specifically in the ADOS. So what can you expect at an ADOS test? There's an article we will link in the show notes that might help you if you are coming in to get an ADOS test somewhere. There are 4 modules based on a child's current language ability, so the test is appropriate for them. So module 1 is the child would be minimally or nonverbal, and then module 4, which includes adults who are very verbal and conversational. Each module involves a number of structured tasks, such as playing games with younger children and asking older children questions about school, friendships, and feelings. Clinicians will also observe how the child responds or interacts with them and will take notes and/or video record the assessment for later note-taking. For example, they may give the child a block task with not the right blocks or the amount of blocks to see how they react. One of the common subtests within the ADOS for the first module, module 1, with a child who with limited to no language, is they make a birthday cake out of Play-Doh and they put the candle in, and there's certain things that the professional is allowed to say or not say, and they look for a child's ability to sing the song or hum the song or be calm while the song is being sung, to pretend blowing out the candle and that sort of thing. So it uses a 4-point scale to score behavioral items related to autism spectrum disorder. And this scale is based on direct observation and how much prompting is needed to elicit a response and interviews rather than subjective clinical judgment. So there may be the scores of 0 would indicate normal behavior. 1 indicates age-appropriate behavior. 2 indicates mildly abnormal behavior. 3 indicates moderate to severe abnormality or abnormal function. And 4 indicates severe impairment. And each subtest as part of the module or each section would get scores. And the ADOS is usually only one part of an autism assessment. For young children where an ADOS isn't feasible or the child needs to be assessed in the home or at preschool, I mentioned before the STAT, the screening tool for autism in toddlers, originally developed by Dr. Wendy Stone, can be used. And in the past, like I said, I've been trained in both the ADOS and the STAT and certified in the STAT. The next assessment tool we're going to talk about is the Vineland Adaptive Behavior Scales 3rd edition. This is not a screening for autism. This is a screening for developmental delays, disabilities, and intellectual disabilities. It is like the ADOS. It's a standardized assessment that's completed by professionals who are trained in the Vineland. The Vineland takes between 10 and 40 minutes to complete. It measures a range of functional domains and subdomains, including communication, daily living skills, socialization, and motor skills. Who's the Vineland for? Like the ADOS, a wide range of ages, birth to 90. There's a parent form that can be used for any age, and then the teacher form can be used for children ages 3 to 21 where you're trying to complete a Vineland. Now, there's differences from the ADOS versus the Vineland. This is generally related, the Vineland, to adaptive life skills and is a questionnaire given to parents, teachers, and other caregivers versus direct observation like the ADOS. The Vineland can provide valuable information going forward in making treatment plan, education plans such as IEPs, 504 plans, etc. The Vineland is scored on a scale of 0 to 3 with higher scores indicating higher adaptability skills and behavior. For example, a 3 might be always does this, and a 0 might be never demonstrates this skill, such as hand washing or speaking. The final assessment I'm going to talk about today is the BECA, which stands for the Barbera Early Childhood Assessment. This is a digital assessment that I created in 2022 based on a 1-page assessment and a 5-page assessment that I started creating almost 20 years ago. And this digital BECA assessment helps parents and professionals get a solid baseline data on their children or clients with autism or speech delays, developmental delays, or possibly showing signs of autism. The BECA is not, at the time of this recording, not yet valid or reliable, yet it's very much aligned with the VB-MAP and standardized speech testing in some cases where we've compared those things. The BECA helps parents and professionals get a baseline in self-care and adaptive skills such as picky eating, sleeping, grooming, dressing, and potty training. It also gives scores and gives a baseline in terms of language and learning skills, and a third category of problem behaviors. After the BECA digital assessment is complete, you can identify strengths and needs and develop a one-page plan. It's designed to help you create a plan for programming and teaching, which can be done by both parents and professionals using my online courses as well as my Turn Autism Around book. The BECA can be very useful if results are shown to pediatricians and early intervention professionals and used to make a plan for teaching. It's more like the Vineland versus any kind of assessment, whether it's autism or not. And in my opinion, it doesn't really matter if the child has autism or not. The BECA assessment can really help get the child from whatever their baseline is and make improvements both in talking, problem behavior, as well as adaptive living skills. In fact, there was a 2023 published study on kids, quote unquote, outgrowing autism, getting all better from autism, and there were two factors that led to best outcome in that study, which we will link in the show notes here. And those two variables were being female sex. Females did better. Kids who were diagnosed between 1 and 3 years of age with autism, and if they were female, those females did a lot better between ages 5 and 7. So the other major factor that led to best outcome kids was at baseline having better life skills, having better adaptive skills, such as the 1/3 of my BECA assessment, which takes into account all those life skills such as eating, drinking, weaning from a bottle pacifier, sleeping, potty training, and all the things that are really going to make a difference with or without a diagnosis. The BECA assessment takes approximately 10 minutes to complete. It's online, and results are automatically generated after submission and sent to your email address. Scoring is based on these 3 categories from 0 to 100% scale, and the higher the score, the more skills your child has in that category. And the 3 categories again are self-care, adaptive skills, language and learning skills, and problem behaviors. The higher you score on each area, the less need for intervention. So it can be done at the beginning of a school year, at the end of the school year, to track progress, and you can assess the BECA here, which is still free at the time of this recording, at marybarbera.com/assessment. We will link that in the show notes as well. So in conclusion, you can see that there are many tools we use to, if you're worried about developmental delays and or autism, whether your child or client has a diagnosis or not, you can use these tools to help put intervention programs in place with and without a diagnosis. Each of these assessments are useful for many families where we can use the results of all of these assessments to either help to get a diagnosis, or develop intervention programs for children and clients. I hope this podcast helped you know what to expect when you go to a doctor's visit or talk to an early intervention provider about getting screened or evaluated for autism. So I hope you enjoyed it. If you did, I would love a review. I would love if you would spread this around to anyone who may benefit. And I will see you back here, same time, same place next week.